Optim.AI can be captured, the workflow of Optim.AI can be captured in a 4-step process. So basically, we first start off with sample collection, where we isolate live cancer cells from different tumor types, such as biopsy resections, ascites or pleural fluids, and blood or bone marrow aspirates. So we then perform an ex vivo sensitivity test on the isolated cancer cells by treating them with 12 drugs in a mix of combinations based on a proprietary design. So we then measure the cell viability and use it for Optim.AI analysis, which then generates a final test report that ranks the top single 2, 3, and 4 drug combinations, including any relevant clinical trial references. So the main parameter that we are using is normalized cell viability, or NCV score. So this NCV score quantifies cell killing from 0 to 1 after measuring the amount of viable cells left after drug treatment. So a NCV score of 0 indicates that all cancer cells are killed, highlighting increased sensitivity to the treatment, and vice versa if the NCV score is closer to 1. Basically, I think as long as we can get a sample of the tumor tissue, we can test all cancer types, yes. So I think in our experience in our lab, there's more than 20 plus cancer types, including cancer of unknown primary, and some even very rare cancers. We have also processed them before. Right now, for our Optim.AI test, we do short-term culture of the tumor cells. So for hematological cancers, we seed, and within 24 hours, we will do drug treatment. So there is no real opportunity for the cells to have to grow, or whether or not for them to die of too much. So for solid cancers, it's a bit longer, because we want them to form 3D organoids before we actually do drug treatment to try to mimic the internal system better. But still, it is still short-term culture. We are not expanding or trying to grow the tumor cells from the primary tissue.
In sarcomas, unfortunately, most of the time, if you do NGS testing, you don't find very much. So it doesn't tell you anything. So I think this is actually one of the areas where ex vivo drug testing can potentially be more useful than NGS testing. Right? So right at the start, if you remember, I think I showed you very few actionable alterations. So a lot of the genomic testing that is done is really more for the diagnostics of sarcoma. You find certain fusions, it's an Ewing sarcoma, you find certain things, it's this particular subtype of sarcoma, but it doesn't tell you anything about how to treat it. Right? So I think this is one of the areas actually that ex vivo drug testing might be more useful than NGS testing. Various other labs have actually come to me to ask whether they can work together and collaborate and all that. But in general, I would say that a lot of them are either testing single drugs, very limited numbers. They don't have the ability to, test it on larger numbers. I think here, because we're using small-scale AI as well, so that actually helps. And those of the rest who actually do this in animal models, so some of them actually do this on PDX, okay? I wouldn't suggest it, because it takes a very long time to generate a PDX anyway, 3 to 6 months if you're lucky, And a lot of the time, with a very small amount of tumor, you also can't test very many drugs. So typically what I see is maybe a panel of about 5 or 6 drugs and single drugs. And by the time you get the results, it's not very relevant to the patient.